FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.
Welcome. You are listening to the Financial Survival Network. I'm Kerry Lutz. It's 5/7/19. Well, a lot of talk about Obamacare. Perhaps the courts will strike it down. Perhaps they won't. But really, what you need to be thinking about is how to stay healthy, not what to do when you get sick. Yes, you need to have plans in effect should that ever happen. But if you focused more of your efforts on staying healthy, think how much healthier you would be. Hey, as always, join the discussion, be a part of the show. Email us, kl@kerrylutz.com. Well, talking about staying healthy, about all of this, Rich Wessenberg, you're with us now. Rich, insurance guy, certified healthcare consultant, preventive care advocate, and licensed health insurance professional. You got over 20 years of experience. We appreciate your coming on. So first, Obamacare update. Where do we stand on Obamacare right now?
Well, that particular legislation is still in force. The one big thing that was taken away was there's no penalty for people to not, in the individual market, to not take health insurance. We still have penalties out there in the group market, in the large group, to have health insurance. And so what we're looking at, though, if you take just the facts of it, is this thing has evolved where it's unaffordable. You have this system, it's kind of a hybrid commercial Medicaid system because the government's involved with the commercial market. And what has happened since the law has been in place, the rates, inflation, basically, if you're making over 250% of the poverty level or, 500% above, which isn't, that much money. We're talking $50,000, $60,000 a year. And you're going to be responsible to come up with all the premium dollars. And the thing about this, Kerry, is we have evolved into this day and time where these premiums, I'm even shocked since I got into the industry, because when we're looking at anywhere from $500, $600, $700 a month for single, $1,200 to $2,000, $2,500 for family, really the working class cannot afford this, and something's going to have to change.
Yeah, something's got to give. So what is going to give? That's the question.
Well, that's, when I first got into the healthcare system and learning the fundamentals of the insurance side of it, it was told to me that insurance premiums are just a barometer of the cost of healthcare. And so, and then the message was, if you just stayed healthy and didn't use your insurance, the premiums would stay lower. Well, there's a lot of things that the American public doesn't know about the numbers. And really, that's what all this business is about numbers, is that it's very few a part of the population. And in the business, it's called the 80-20 rule, where 20% of given population will use up 80% of an insurance pool's reserves. And so this phenomena correlates with, we're in a great day and time. There's a lot of medical advances that will save your life, prolong your life. But the price tag at this is where we're hitting the pavement, and a lot of other issues in the system that have been going on for decades. And it's just never been properly addressed. The Affordable Care Act, with all its great intentions, it didn't address the whole picture. Sure, if you're at 250% of the poverty level, you're going to get, a government subsidy to pay for your premiums. You're going to get a cost share to take care of your deductible. You don't have any out of pocket. That's where I say it's a hybrid Medicaid system. But when we look at above this for the hardworking middle class guy, that $50,000, $60,000, $100,000 a year guy, they're going without insurance. And if you're 200,000 or more, you're getting into a very, finite group of people and are, purchasing their policies. And so there's this gap of going on and struggle. And it's even on the, I've been talking, Kerry, about the commercial side, but when even you talk the Medicaid side, that's a government share with the state and the federal government. And even a lot of states are struggling and have been struggling. It's the number one cost item on most states' budget items. And so it's all coming back to the system, to hospitals, doctors, where we've evolved in these costs. Prescription drug is the big one lately, and we're going to have to tackle these as a country. Medicare, all of us are paying 1.45% of our paychecks into Medicare, and that's only funded till 2026. We got some serious issues. They got to be addressed.
Mm-hmm. Agreed, for sure. So it's got to be addressed, but it's not being addressed. And the Republicans don't want to address it. The Democrats don't want to address it. The the Democrats are largely responsible for the mess that we're in. And where's there a way out here?
FSN Radio. It's all about what's next.
Egypt is on the verge, once again, becoming a world-renowned gold producer. The Golden Age is being rediscovered. For millennia, ancient Egyptian kingdoms prospered from unparalleled riches. Pharaohs built their empires and flaunted their abundant wealth that was made possible by the country's resource-rich gold deposits. Despite this rich history, modern Egypt remains one of the most underdeveloped gold mining countries in the world. Eitan Resources is at the center of the modern Egyptian mining world, diligently working both as the only public exploration company in Egypt today and as the advocate for mining reform with the Egyptian government. However, those that arrive early like Eitan will reap the best rewards. Eitan's discovery of the legendary Lost Mountain of Gold at Radruin and its current aggressive drilling program there could potentially reap those rewards. Eitan Resources is focused on its 100% owned Abu Marawat concession in the Arabian-Nubian Shield, located 200 kilometers north of Centamin Sakari's world-class gold mine. Eitan possesses first-mover advantage in the underfollowed jurisdiction of Egypt, which is currently undergoing mining reform. To stay on top of Eitan's latest drill results and news, go to eitanresources.com. Eitan trades on the Toronto Venture Exchange under the ticker AAN and on the OTC under the ticker ANLBF.
The Financial Survival Network. It's all about what's next.
Well, when we follow the history of all of this, health insurance, the concept being in the 20s and following its history, 65, it was Harry Truman brought in Medicare and Medicaid. It was all addressing the needs. I mean, the government agency, Health and Human Services, in the 50s began to address the health of America. Mm-hmm. And so we've been doing this, but as it's been going on and the technology and these things like, the Affordable Care Act came about because the old system wasn't working. And when you look at that old system, and I grew up in that system in the insurance business.
Sure.
Every year delivering rate increases. And when you saw the cost of inflation of this healthcare industry outpacing regular inflation, employers struggling. And I did a lot of meetings, Gary, sat in front of employees. We're going to have to drop your group insurance. And the voice that is hardly heard because, like I said, most of a population, 70, 80%, you got nothing going on. Mm-hmm. That 20% or even less that has a serious illness, or you've committed the crime of getting a chronic disease. And we have, the pharmacy world is phenomenal. MS is treated $5,000 a month prescription drug. What are you going to do, with that neurological disease? And that's the pressure cooker we're in. We have premature babies today that are born, and in the past would have never lived, but $6,000 a day in ICU in a children's hospital. And we want these babies to live, and yet the price tag. And so this is that struggle. This is the pressure cooker. We all want the best of both worlds, and we as a country have to come together. I understand it's a political issue, but we have to look at this as an issue together. And I was really glad how you brought up, the wellness part of this. I am the national salesman for a company called Wyoming Health Bears that does low-cost blood draws. And actually, we talk politics. Senator Barrasso from our state of Wyoming was the founder, and he actually was on national TV not too long ago saying, hey, this is where we need to go. Preventive care, diagnose things early. And I would even take it further. I think we should be in our elementary schools. Even the ancient teachings tell us to treat our bodies like a temple and get into, we have the technology where we would be starting to pre-screen our health all through our journey of our lives. And, I know people struggle with the genetic and looking what could be ahead. Either way, the bottom line is I can tell you that anything caught in its earliest stages will save money, save lives. I caught pre-throat cancer back in the 90s. Here I'm 55. Mm-hmm. And I saved my insurance company a lot of money. there's a lot of value in that, Kerry, a lot of value.
Ounce of prevention's worth a pound of cure, and losing weight, all of these things for sure are definitely things that you need to be looking at. So, but what is the solution here on a large scale? I mean, one of the things is pre-existing ailments or maladies, diseases, and we really need to deal with that. But that was the justification for Obamacare, and really it turned out to be a complete nightmare.
Yes, our political system and how legislation goes through. I've read books on it, and the weaknesses that are in it. Something is going to get molded and shaped, and so many different interests that once that guy rolls out may be totally different from initially, and that's just our system. And so to me, to address this issue, to get affordable health insurance, again, it's by the numbers. And, the Medicare for All discussion. Now, I would tell you, I've traveled in these circles, a lot of top insurance people, take away the political side of it. If you had a national pool and you're working the numbers and not associated with any special interest, obviously larger numbers are going to drive down costs. Now, is that the best solution, to have the government oversee this or all of these things? All I know is we got school systems that run it, and they're not perfect, but this cost of healthcare is not affordable. Like I said, the history of this, we were at with the commercial side, went to the Affordable Care Act. Now where do we go? Because nobody wants to take ownership of this high cost. We've set up legislation to kind of get around it because the doctor still wants to get paid. The specialist wants to get paid. And I get that. Those guys spend a lot of time in college. We've got great advances. The prescription guys want to get paid. Hey, you know what? We got a cure for hepatitis C, liver disease. I had customers die waiting for liver transplants. And there's only going to be more solutions. I personally believe, after my research, we're going to have cancer cures. We're going to live a lot longer. This next generation, it behooves them to take care of themselves better, because with the medical advances that come down the pipe, yes, aging, living longer is going to be part of this picture that's already developing. Yeah. And the key is the affordability struggle.
Sure. I gotcha. All right. Well, we have to go now. Just tell us, we want to find out more about you, connect with you on the web. Where do we go?
Let's go. I'm at WyomingHealthFairs.com is our website. And I'm on Twitter at Wyoming Health Fairs. At Rich Wyoming Health Fairs, and you'll see me, Rich Wessenberg. But that's where I'm at, is on the Twitter, and on Facebook, also Wyoming Health Fairs. You'll find me there. And again, I think let's all strive for preventive care, screening, early detection, and do the best of the things we can control.
Absolutely, could not agree with you more. Hey, questions, comments, email us KL@KerryLutz.com, Twitter feed @KerryLutz. Facebook page, Financial Survival Network. Hey, thanks so much for coming on. Really appreciate it. And good luck in what you're doing here.
Thank you so much, Kerry.
FSN Radio. It's all about what's next. Go to FinancialSurvivalNetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.